was taken to Parkland and received incredible care, but she couldn't afford that care. And so it is looking for those opportunities and grant funding and federal dollars and tax-supported dollars and charitable care that we're really tapping into to be able to give care to everyone. So medical debt and specifically medical debt for our patient population, it's I don't know as relevant if it's as relevant as private health care, but I do want to say that is an issue, and I totally understand that you're worried about it.
Okay, and I just have one more question. So if, being that you guys are, subject to elections and the community and all this kind of stuff, what would you say, if there was a coalition of people in this room who were had, hundreds of thousands of dollars worth of medical debt, what would be your advice to them and with ways that they could take their power as voters to change policy to help alleviate that problem?
So this is Vidya wearing her Vidya community activist hat and not just speaking on behalf of Parkland. So I will say that as with any issue, if you're asking for the sake of medical debt is one thing, but for any issue, you have way more power at the local level to talk to your local elected officials, to make sure that policies are reflective of anything that you might need as a community. And if you're experiencing things where your policymakers are the power of the collective voice, the power of your individual voice and the power of the collective voice, and how I, on my spare time, encourage people to go and speak to their elected officials about issues that maybe that you like you specifically care about medical debt. There's a lot of other issues that groups care about, and I think that it is very important to take an active role in local elections, and that's the only piece of advice that I can give, and kind of encourage everyone to take part in, and it's not necessarily specific to medical debt. And I don't know what else to say. From a federal level, we could get ourselves into a long conversation here of ways in which we can influence policy or encourage policy. I think that action is speaks louder than words sometimes too, and so to take collective action is very important.
Thanks.
Other questions? I can keep asking questions, but I may not be the most interesting person here all the time. Other questions of thinking about models for health and improving health? Come on up. Come on. It's good for them to talk to you directly.
All right, so I grew up in the Rio Grande Valley, along the Texas-Mexico border, and one of the health innovations down there in an extremely medically underserved area is promotoras. The promotora model is basically healthcare workers, and it's really looking at it from a different dynamic. It's not about the doctors and the nurses, it's about preventative care from the inception. Is that a model that Parkland, our community, is embracing? I think our community in the Rio Grande Valley was just sick and tired of being sick and tired, and they took it upon themselves to educate mostly women to go out into the community and be those health advocates on behalf of that client. And the outcomes have been amazing. And I'm surprised that I haven't heard more about it across the country.
One thing I wanted to share is the thing that me and Vidya were talking is the future of healthcare is community health workers, not technology. So that is where we need to invest. It's about, I'll give you a couple of stories. We decided to select our high-risk, high-utilizer patients in each of our clinics. So about 50 patients, and work on them for a year. It's a multidisciplinary team addressing both their clinical and their social needs. And our goal was 20% reduction in the ED visits. And to our surprise, there was a reduction of 70%. So now we are expanding fast because it goes back to showing outcomes. It's not only reducing the ED visits, but we also want to make sure that they're keeping their primary care doctor appointments so that they're getting the regular care. It's not that they just lost care or go to another facility. The other example I wanted to share was we did a walk around City Square talking to patients of people who are living on the streets, trying to understand how we can be of help. The first two people we met sleeping in the street were Parkland patients. And one of the lady she said, oh, I go to the oncology clinic at Parkland. Like somebody with cancer sleeping in the streets. But I'm not sure if the people who developed their care plan thought about how are they going to execute whatever we asked them to do. Just print the sheet and give it to them. When in our previous discussion, when we talked about education, they're worried about paying the bills and the rent and all that. So it's the same thing. People don't worry about taking their medication when others are in the So absolutely, I agree with you. We need people.
I'll jump in too. We have a program going on right now, where a pilot program where we're training barbers and beauticians in South Dallas to do preventative healthcare work. So they'll check the blood pressure of somebody whose hair they're cutting, and then say, "Whoa, this is really high." So we said, who are the leaders in the community in South Dallas? Where do people go? Well, one of the community hubs is the barbershop or the beauty salon. And so we're training barbers and beauticians to be the front line in a couple of different preventative healthcare metrics. Where then if they find somebody that's hypertensive, they can direct them into our clinic. So before that, there used to be Project Access, which was a partnership between the medical society and the hospitals, where it allowed uninsured working folks to get access to specialty care. And we ran that with community health workers. So we were training folks from the community who then helped people access specialty care that the hospitals and medical society were coordinating. When we didn't expand Medicaid in Texas and they came up with this 1115 medical waiver, there was a fight over that. It's called DSRIP. That DSRIP money and the Project Access went away. But we used to train community health workers for Project Access as well. So that's been effective in our work. The barbershop's our latest kind of cool little, let's try something new and different. We're doing that in South Dallas right now. We think it's going to lead to some great outcomes in that community.
Okay. And to that point, this is the exact model that we're looking at too. I feel like Roy asked this question to make us look good because we have all of this innovation happening in the community health worker space. And another point that we're leveraging is actually a faith health collaborative. So recognizing that there's so many congregations in the area, and within that network, having members of the congregation come forward as wanting to be kind of healthcare leaders in their faith health community. We're training them, giving them extra curriculum to be able to look after. And so it's kind of this upon discharge piece from the healthcare standpoint. The hospital providers also have a pastoral care when you're in the actual hospital, but when you're being discharged, it's the community that cares for you. And so if you're already belonging to a congregation and having a support system within that network, we're working on that, and that's kind of based off of Memphis's model. But we're also incorporating a CHW, injecting the community health worker, which is a state level program, the Pomodoro program, into the hospital for addressing social determinants of health specifically.
Yeah, and the really good ones will address issues related to housing, workforce, other transportation. So you name. Thanks, guys. Appreciate it.
I think Texas is the only state that actually certifies CHW.
I don't know if they're the only one, but they do. Yes, we have somebody on our staff that can do the certification process.
There are other states doing this.
standpoint of how we're doing it in Texas and adopting that model, but there are CHW kind of models that it actually stemmed from Chicago, where their model of healthcare was very community-based. And just like the story that John said earlier of the woman who took it upon herself to become a diabetes educator for her community, it's the abuelas of the community, the ones that really everybody goes to for help anyway, and identifying them and giving them the resources that they need for social innovation.
So one final question, rapid fire answers from each of you. If you wanted to get started in thinking about how to approach an outcomes-based way of doing healthcare, where would you get started? So what advice would you give to people?
Patience. As with everything that you're trying to do with outcomes, we can't be prescriptive anymore in any industry. It always has to be your end user. So think of your customer base. And for healthcare, it's our patients. So involving them in our care, involving them in the processes that we are about to implement, any new model of care that we're thinking of, care delivery models, everything involves the patient as that initial person that we go to.
I think if you're in the nonprofit space, collaborating with the healthcare system, because the system is geared toward metrics and outcomes anyway, but then a conversation where you help broaden what metrics are considered. So, they may be looking at clinical metrics about what did their blood do, but you can expand and say, okay, here's some social determinants of health or quality of life issues. Hospital systems usually have the mechanism for getting outcomes and evaluating them. Then we can bring some of the human design to that, and it's a really good partnership.
Healthcare is all about clinical outcomes, right? Diabetes and the other diseases. That's how we come up with best practices. But healthcare is beyond, I'm realizing it is beyond just treating that disease. It is about the whole making sure that they have a productive life. And what is the measure of that? I'm still trying to figure that out.
I think what you hear from this panel and what you've heard from this morning is whether it's education or whether it's healthcare, there's no one single point. There's only one way to answer. It's thinking about the community around it and thinking about how the community is addressing the problem, not just physically a community, but the community of issues around how to make sure someone can graduate, or how to make sure someone doesn't have to come back to a clinic or a hospital, but really thinking about the 360 around everything that we do. And most importantly also, and I think one of the things that we kind of touched on here, but also thinking about how we incentivize that payment. So we're not just paying for a number of people that can walk through a door, but really thinking about how we also pay for achieving the outcomes, which requires, I think, what John and Dr. Kumar have also talked about, a little bit of testing and being willing to test ideas, throw them out if they don't work, and retest them again if they do, and try it again many more times. There's a little bit of a fear sometimes of trying new things, especially amongst funders, but also thinking about how we can do that effectively. If the comparison we're making is the current status quo, that's not good enough. So if the fear that we have is it might not work, it's already not working. So I don't know what we're fearing against. If the question is, let's try something because it might not work, maybe the beauticians and the barbershops don't work, but at least it's worth a try because the status quo is not great. And we have to be willing to push beyond the status quo.
Real fast, I'll give you a great story about when it doesn't work. We used to have a youth, we hired youth from the community to be youth counselors, and they got paid to run immersion camps where like youth groups from the suburbs would come in to do an urban immersion. And so urban kids were getting to be these youth volunteers and youth leaders. We also started as a social enterprise, this lawn business, and it took off and was making all kinds of money. And so it kind of got off mission when we were having to just get bodies in there. Well, our crowning moment was on a Friday when our banker called Larry and said, "We've got a problem, you need to come down here. Your yard crew is selling weed to your youth volunteers." So that's one of our favorite failures, is when we had to end our lawn business because we were dealing in the wrong kind of weed. So.
All right, I can't top that answer. panel for
So surely you won't be mad.
I'm going to be really quick. I know we said we ended at 2:30. So again, just want to thank everyone again. Thank you guys for coming and your patience. For me personally, it's been an amazing day to have a combination of hearing what's happening in Dallas and the incredibly inspiring work you guys are doing, and also having people like Guy talk about what's happening around the country. And just a few technical things. If you look in your program, we have this. Hopefully yours doesn't have footprints on it like mine does. Please do take even 3 minutes right now, just some really quick questions. We committed when we began this work that if we're going to do a campaign on outcomes, we got to hold ourselves accountable to outcomes. So it's not good enough that we counted the number of butts and seats at this event. We actually are holding ourselves accountable to our donors that coming here has been helpful for you and helped you for your work. So our way of getting data on that is if you can fill this out, it's a little test on your knowledge of outcomes coming in here today, as well as some helpful feedback for us on how we can do things better. So please do take a few minutes, and Janet at the back will take those out. She also has pens for everyone, so if you don't have pens, no excuse. Please do that. Again, I wanted to thank the donors who make this possible, Bank of America being the lead donor here, as well as some private foundations, all of you for participating. And for me personally, Jen knows that we're very busy. It's a long way to travel. I have an 8-month-old at home, so for me, traveling has always been painful. But I'm so grateful I came today, and really because of something I heard throughout the day, and that is this work is really, it's about keeping your outrage and your optimism in balance. And when I say outrage, it's the moral outrage of what is happening in this country, where we are starting to forget, if we ever remember, that we have obligations to each other. And I think we get very analytical and technical in this work. We cannot forget that we are talking about these issues in a political context in which these ideas that say we should only fund social services and create evidence is actually quite dangerous. Because in the hands of the wrong people who say, oh, well, see, these smart people have said most things don't work, there's no evidence in our return outcomes, let's just cut the funding anyway. We cannot let this agenda be used by people who don't have a commitment that says we have a fundamental obligation to take care of each other. So I think we have to hold on to our moral outrage of the way this country is and where it's going. But how do you hold on to your outrage without becoming dysfunctionally paralyzed by despair? And for me, what I really take away from today is that alongside outrage, we have to have optimism. And I come up incredibly optimistic that you guys and every one of the panelists and the people in the room are doing amazing work. I really feel like we are shoulder to shoulder in this movement with all of you, the most inspiring people. And how do we hold on to our outrage without becoming despairing? And how do we hold on to our optimism without becoming naive? But I know I personally couldn't do that if I didn't feel that I was part of something bigger. I think we've heard a lot today. You don't solve outcomes by worrying about your own institution's budget and growing your own ego. You only do it alongside all of you. So I leave today incredibly heartened about the kinds of people who are gathering in this movement, who are outraged at how we are, but optimistic at how we can be better. So thank you guys, and I look forward to everyone continuing the conversation. Please do get in touch with us directly. If there's any way that any of us can be helpful as well. Thank you.
Are you collecting? I'm collecting. Thank you very much. Thank you.